One side typically is going to heal a little bit better than the other, and so we don't get nervous about that, and we just try to remind them and support them through their journey. If we combine surgeries, it still is about 2 weeks until they're really back to full normal activity. We restrict any sort of big, heavy upper body workouts for about a month, and so we want to prevent any sort of big, aggressive weightlifting or pushing, because when they push, that can displace the implant, pushing it out to the side or pushing it down. And so we have them avoid that stuff. And we just want to baby the scar a little bit. The scars mature over a year, but the first milestone that we see is about 3 weeks. And they're going to be about 80% as strong as they're ever going to be at 3 weeks. And then at about 8 weeks, that's the second milestone. That's kind of their second journey. And then it's going to be as strong as it's ever going to be at 8 weeks. So if we can get them through halfway point, is that 1 month point, then we get back to normal stuff, and then by 8 weeks they should be good to go. If they have implants, I want them to avoid any immersion or submersion in water for 3 weeks. I want them to be totally waterproof, and I don't want to have any risk at all of involvement or potentiation of infection with the implants. If those get infected, it can be a big deal. We talked about capsular contracture a little bit, that the biggest risk of implants is the capsular contracture, and the latest science has shown that that's from a bacteria that gets expressed from the nipples and gets on the implants and festers and develops there over time and can cause problems. So we see them back throughout that first year pretty frequently.